Welcome to Nursing Journey. Today, we're going to demystify one of the most challenging, but honestly one of the most crucial topics in nursing: acid-base balance. We're going to break this whole thing down into 5 super clear steps. We'll start with the absolute basics and build from there, step by step. The goal here is to give you a solid framework so you can look at any arterial blood gas result and know exactly what's going on with your patient. All right, let's get started. Okay, so first things first. Let's lock in the single most important number you have to know for acid-base balance. I'm talking about the normal pH of human blood. Your body works around the clock, non-stop, to keep its pH in this incredibly narrow little window. I mean, think about it. Just a small shift can be catastrophic. A pH below 6.8 or above 7.8, well, that's generally not compatible with life. But what even is pH? You know, it's just a fancy way of measuring hydrogen ions. Here's a simple rule to burn into your brain. The more hydrogen ions you have, the more acidic you are, and that means a lower pH. It's kind of counterintuitive, but you'll get it. So if pH is all about hydrogen, who's in charge of controlling it? Well, it all comes down to 2 key players in the body. On one side of the ring, we've got PaCO2, or carbon dioxide. Just think of CO2 as an acid. It's controlled by your lungs, making it the respiratory component. And on the other side, we have HCO3-, which is bicarbonate. You can think of bicarbonate as a base. It's managed by your kidneys, making it the metabolic component. This whole acid-base thing, it's basically a constant tug of war between your lungs and your kidneys. So how in the world does the body pull off this incredible balancing act? Well, it has this brilliant 3-tiered defense system. You can think of them as the guardians of its pH.
And here they are. First up, you've got your chemical buffers. These guys are the first responders. They act in seconds, like instant shock absorbers. They're fast, but they can get worn out pretty quickly. Next up, the second line of defense, the lungs. They kick in within minutes just by changing how fast or slow you breathe. And finally, you have the heavy hitters, the most powerful defenders, the kidneys. Now they're slow. They can take hours or even days to really get going, but they are by far the most effective at making a long-term powerful correction.
Okay, this next part is a clinical pearl you absolutely must never, ever forget. I'm talking about the critical relationship between hydrogen and potassium. So here's what happens. When the body is in acidosis, the blood is just full of hydrogen ions. To try and hide them, the body basically shoves these hydrogen ions into the cells. But to keep things electrically balanced, something positive has to come out of the cell, and that something is potassium. So potassium floods into the bloodstream, and boom, you get hyperkalemia. In alkalosis, the exact opposite happens. So what's the big takeaway for you? Whenever you see an acid-base problem, your brain has to immediately think about potassium, and you better be watching that cardiac monitor.
All right, now that we know how the body defends itself, let's talk about what happens when those defenses get overwhelmed. This leads us to one of 4 main problems. We'll kick it off with the respiratory side of things, starting with respiratory acidosis.
At its core, this is a breathing problem. It's caused by hypoventilation. That just means not breathing well enough. See, when you don't breathe effectively, you hold on to carbon dioxide. That CO2 then mixes with water in your blood, forms carbonic acid, and your pH starts to drop. Think about patients with COPD, pneumonia, or someone who's had too many opioids. They're all at risk.
Okay, let's try a quick question. You've got a patient with broken ribs, and it hurts so much they're barely breathing. They're splinting their respirations. Which imbalance are they at the highest risk for? Think about it for a sec.
Yep, you got it. The answer is B, respiratory acidosis. Because of the pain, they're taking really shallow breaths. They're hypoventilating. That means they're not blowing off CO2, and all that trapped CO2 is building up as acid. Now on the flip side, you have respiratory alkalosis. This is the exact opposite problem. It's caused by hyperventilation, breathing too fast, from things like anxiety, pain, or a high fever.
So let's switch gears to the metabolic side. With metabolic acidosis, the problem isn't the lungs. It's something like diabetic ketoacidosis, or DKA, or maybe kidney failure. But here's the cool part. How does the body try to fix it? It uses the lungs. The body goes into panic mode and triggers this super deep, rapid breathing. We call it Kussmaul's respirations, in a desperate attempt to blow off as much CO2 acid as it possibly can.
And last but not least, metabolic alkalosis. If you're studying for an exam, the #1 cause you need to remember is loss of stomach acid. This usually happens from tons of vomiting or from NG tube suction. You're literally losing hydrochloric acid, which leaves way too much base, or bicarbonate, hanging around. So let's test that idea. A client has an NG tube hooked up to low intermittent suction. What imbalance should you be watching out for? Take a second to think about it.
That's right, B, metabolic alkalosis. By suctioning out all that stomach acid, you're setting the stage for it. Okay, you've totally got the 4 imbalances down. So now let's get to the part you've been waiting for. A simple, foolproof, 4-step method to interpret any ABG result that comes your way.
This is the 4-step process you're going to use every single time. And to make it even easier, we're going to use a super helpful mnemonic, ROME. It stands for respiratory is opposite, metabolic is equal. This just refers to which way the values are going compared to the pH. Let's walk through an example so you can see exactly how this works.
Okay, let's break this down together. Step 1, look at the pH. It's 7.28. That's low, right? So we know we're dealing with acidosis. Now, step 2, look at the PaCO2. It's 55, which is high. So did you see that? The pH went down, but the PaCO2 went up. They moved in opposite directions. And since respiratory is opposite, boom, we can say with confidence this is respiratory acidosis. And see how the bicarbonate is still in the normal range? That tells us this is uncompensated. The kidneys haven't had time to step in and help yet.
Awesome. So now you can interpret the results. But hold on. How do we even get those results safely? Well, before you can draw an arterial blood gas or an ABG, there is a critical safety check you have to perform. It's called the Allen's test.
This quick and simple test is a huge deal. It just confirms that the other artery in the wrist, the ulnar artery, can supply enough blood to the whole hand, just in case something happens to the radial artery during the poke. It's a non-negotiable safety step. Okay, let's bring all this knowledge together now with one final scenario that will test everything we've talked about.
Your patient has respiratory acidosis. Which of these nursing interventions are you going to do? Read through them carefully and select all that apply. I'll give you a moment. The correct answers here are B, C, and E. The whole problem in respiratory acidosis is that the patient is holding on to CO2, right? So our goal is all about improving their breathing. Putting them in a semi-Fowler's position helps their lungs expand. Encouraging them to turn, cough, and deep breathe helps blow off that extra CO2. And you would never give them opioids or sedatives because that would just slow their breathing down even more and make the acidosis dangerously worse.
All right, so let's quickly recap the absolute must-know points from this whole thing. First, burn that normal pH into your memory, 7.35 to 7.45. Use the ROME mnemonic, it's your best friend. Respiratory is opposite, metabolic is in the same direction. Never, ever forget that critical link between acidosis and high potassium and alkalosis and low potassium. And maybe most importantly, always remember we're trying to treat the underlying cause of the problem, not just the numbers.
At the end of the day, your job as a nurse is to be a detective. You identify the imbalance, you keep your patients safe from all the scary complications like cardiac problems, and you support the body's own amazing systems while the team works to fix whatever caused this in the first place. You can do this. If you liked this video, don't forget to like, share, and subscribe or follow.